Narendran,
Ananya, are you there?
Yeah, good evening, everyone. Yeah, thank you so much.
Mental health webinar series session, sir. Yes, Chandra ma'am, we can begin the session. Will you ready to do the speaker today?
Yes, sir. Okay.
We begin the session now, sir.
Two minutes. I will send the link to my student. I will send a link to my student. We'll begin this. 1 minute, 2 minutes, sir.
Sure, sir. Narendran, sir, meanwhile, do we have any PPT today for the presentation?
Yeah, I do have a PPT with me.
Check whether it is working properly.
Yeah, sure.
Yes, sir.
I think it's visible to everyone.
Yes, it's visible, but can you make it as a full screen, sir?
Yeah, I'll do that.
Yes, sir. It's
Yeah.
perfect, and your audio also. It's audio.
Okay, thank you so much.
Yes, sir.
Yes.
Probably in another few seconds we'll begin the session, sir. After
No
welcome.
problem. Take it. Yeah. Thank you so much.
So we'll begin the session, sir.
Yes, sir. Thank you so much, sir. Yes, Narendran, sir. Sir.
Yeah, sure. We can.
Okay. Good evening. In the cheerful Saturday evening, we are here connected to enrich ourselves in the topic of role of CPR and peer support in mental health, which is our 82nd session of mental health webinar series. 14 months of mental health webinar series 20. Welcome our lovely participant and honorable speaker for the day, and behalf of Department of Psychology, the American College, Madurai, Madras School of Social Work, Chennai, International Center for Clinical Psychology and Psychotherapy, Germany, MS Chalamuthu Institute of Mental Health and Rehabilitation Center, Madurai, Redmond Education and Psychological Research Center, Madurai, Psycho-Oncological Association, Turkey. So, welcome all the sincere participant and the today's speaker. To have a great session, I request all the participants, please mute your audio as well video, and all your queries can be clarified in the QA session. So further, to introduce about our today's speaker, I request the core team member, Dr. Chandra ma'am, to proceed. Dr. Chandra ma'am.
Sir, can you hear me?
Yes, sir.
Okay. Good evening, everyone. On behalf of the core team, I would like to introduce today's speaker, Mr. Narendran. He is a social worker, transaction analyst, and a master practitioner of NLP. So he has always been dreamt about NLP and he's doing great work on it. And he has graduated his master's from Madras School of Social Work, specialized in medical and psychiatric social work. So he has got a rich experience as a field and seed center coordinator working in Bangalore. He has also been a project coordinator in different institutions in Chennai. So he has organized, conducted, and counseled different field work and internship trainings. So he has been working also with counseling cancer patients, which is really interesting to know. And as a professional training, he has undergone courses with different institutions in India and also in United States of America, being organized by different institutions. And he has got his dissertation on attitude of children towards their mentally challenged sibling. Having said all this, we are also happy to know that he has received the best social worker.
Chandra ma'am, you have
Ma'am, you are not audible. It's I request Narendran sir, without any further delay.
Hear me now? Can you hear me
yes.
now?
Now we can able to hear you.
So until when I have been audible, can you let me know?
Probably no, maybe almost 1 minute.
Award something.
Okay.
So you introduced him fully.
Yeah, that's okay. Let's begin the session.
Without any further delay, can begin the
Yeah.
session. Welcome, Narendran sir.
Yeah.
Chandra ma'am.
Thank you so much for having me today for the session, and thanks Chandra ma'am for introducing me to the group, and thanks for the entire coordinating team of this webinar. All the stakeholders of this webinar, thanks so much. So today's topic is role of CBR and peer support in mental health. So before we begin the session, may you know the kind of audience we have today in the group, like students, social workers, psychologists. What's the kind of group we are having today? So it'll benefit all of us in learning and to go further. A small, yeah.
It's a diverse group, sir. You have academicians, you have practitioners, and you have students as well.
Sure. Thank you so much. So as you all know, I have been working in the field for quite some time after passing out from Masters of Social Work. So this community-based rehabilitation peer support group in mental health has been my area of focus for the past few years. Let's say about 3 to 4 years now. So before we go into the topic, let's just have a look at the terminal that we're going to use in the session. So first thing, when we talk about CBR, it's the acronym of community-based rehabilitation. It's a strategy within the community development for the rehabilitation, equalization of and opportunities and social integration of all people with disabilities. So CBR is implemented through combined efforts of disabled people themselves, their families, communities, and the appropriate health, education, vocational, and social service. This definition is according to the International Labour Organization, UNESCO, and World Health Organization in the year 1994. So the entire concept of having a peer support group inside the community has its core with this definition. So when we talk about a peer, who's a peer? A peer is usually used to refer to someone who shares the experience of living with a psychiatric disorder or an addiction. So this idea of starting a peer support group came up to have when you talk about recovery in mental health, it can be categorized as two parts. Like one is medical recovery, the other part is personal recovery. So when you talk about medical recovery, can be taken care by medical professionals, psychiatrists, and all that. When it comes to the personal recovery of an individual to recover from the illness, mental illness, whatever he's going through, the mental disorders or anything. So it requires a lot of personal work, involves a lot of personal work for his recovery. So it includes beginning from self-care to social integration to community acceptance and all that. So even if an individual is recovered from a medical point of view, if he's not being able to accepted in the community, then he will not be able to recover further and be a part of the community that he lives in. So this is why this concept of peer support group in the community-based rehabilitation setup came up. So then we talk about this community-based peer support groups for person with mental disorders. So the stakeholders of these model can be psychiatrists, psychologists, psychiatric social workers, peer support workers, and volunteers, and most importantly, the community. So you can ask me who's a peer support worker or a volunteer. To give you a clarity on that, a peer support worker or a volunteer are those who have been successful in the recovery process and help others experiencing similar situation through shared understanding, respect, and mutual empowerment. So peer support worker or a volunteer help people stay engaged in the recovery process and reduce the likelihood of relapse. So this is the responsibility of the peer support worker or a volunteer to help other patients or individual who's experiencing a similar situation from sharing them a similar coping strategy or understanding them from their point of view, and also helping them to empower and grow in the community. So this is what we'll talk about in this entire session. Then there's a belief about peer support work. A peer support is based on the belief that people who have faced, endured, and overcome adversities can offer useful support, encouragement, hope, and perhaps mentorship to others facing similar situations. So this model is actually very effective in areas like cancer patients dealing with cancer and other medical ailments. But when it comes to behavioral health, and it's not quite encouraged in the community due to various reasons, the stigma, stereotyping, discrimination, and all that. So this is what we'll have to work on to encourage community-based support groups for a betterment of their recovery. So the most important thing about the peer support is our experience. I think I have you all until now. So if you have any doubts in between to clarify, then you can also stop me in between. So the most important thing about the peer support is our experience. So this is how it works. A patient or an individual who has been recovered successfully from a mental disorder and is okay and has gained his pre-morbid nature, then he's able to share his experience or coping strategy to the other individual who is go through a similar experience. So this was actually tested in Gujarat by Dr. Patare. You all must be knowing him very well. So it was a quality rights project in Gujarat which monitored close to 102 individuals in peer support groups in the community. So those who have this peer support group were able to recover faster and go to another level of recovery state than compared to those who are placed in a conditioned places. So this is the group that we had in Gujarat. That study says that peer support, having a peer support group in the community helps the patients and the individuals to recover faster and sooner. So then we have what are the other benefits of peer support. A peer support worker can reach out and connect with individuals at a more personal perspective level. So when we talk about peer support, we all have had a similar experience among ourselves. Like it's not that only a disabled person should have a peer support, or anybody, just like normal people. When we have a problem in life, like a financial crisis or a personal or emotional trouble we have in life, when we share with people and we get we have a feeling that the other person is being understood and we are being listened to, itself is a peer support. And hearing from them what they went through on a similar page, and giving their experience and helping us to cope up with that and overcome the problem, itself is peer support. So that's what we talk about in peer support work. It also empowers the individual to make decisions. So peer support believes that the other individual, no matter what is the mental state he is in, we believe the individual can make his own decisions, and the trust is built towards the recovery process and other mental health professionals. So at times when we work in the community, when we work in the hospital institution setup, we find the individuals have a lot of inhibitions and towards the mental professionals, especially doctors, social workers, and psychologists, and all that at times. So when having a recovered individual along with them helps them build the trust towards the process as well as towards the mental health professionals. So then comes the peer support helps an individual in personal recovery and social integration. Like I said before, medicines and therapies can help them recover medically on a medical point of view, but then when it comes to social integration and personal recovery, like self-acceptance, all comes only when there is a support in the community. So that's why we have this peer support. We should have peer support in the community. And it also increases a sense of hope, control, and ability to effect changes in their life. So when we talk about the sense of hope, they wouldn't have accepted themselves as an individual, as a person, and having someone next to them who had gone through the same situation gives them a sense of hope, and they get a belief that they're able to control their life and they're able to make changes in their lives. And it also increases self-care, satisfaction with various life domains. So when we talk about people with mental illness, especially severe mental illness, they lose self-care because they just don't see the need to be taking care of themselves and all that. So when they see people in the community who are dressed well and he was like me and I'm able to do what he's able to do, then they develop self-care and they develop interest towards various domains of life, like working, like earning money and all that. So it also facilitates knowledge, skills, and linkage to resources, which is very important for a community-based rehabilitation to work. It is not just we tell them what to do, but we help them get that in the community. Most of the times, these mental health patients lose their skills as in the course of treatment. What happens is they don't have, or they don't know, they're not aware of where to go and approach for certain things in life, or to get a job, or to make a living. So it is very important for the community to approach the resources that's available around and help them approach that. So which is very, very important for a community-based rehabilitation. Then why is peer support effective? I hope from all the benefits we have just gone through, I think it's an effective model. But why is it effective? When you talk about why a peer support is effective, it's because the communication in a peer support group is very different. It's even different than how a professional would talk to an individual who's going through a problem. So how is the question? So when we say the communication is different in the peer support group, we use I statements and speak from our own experience, which is more personal, and nobody can judge you for that. So it's always I and what I went through and what I am going to do and all that. So we'll have to remember how an I statement would impact a life of an individual. And we talk about what is true for us and without assuming anything about the other person. When we talk in a peer support group, we lose all these inhibitions that we used to have towards other people, or we do not assume that whatever are we saying the right thing or not. We just talk because it's our own experience. We just talk because it's what we experienced from the situation. And the most important thing in a peer support group is there is no labeling or diagnosing. So most of the time, the patients or the individual have a fear that they're being labeled. I am a bipolar. I am a schizophrenic. I'm an autistic kid. Like I'm a hyperactive kid. Like they have a fear of being labeled, even in a normal setup. So when there is a peer support in the community, they know there is no labeling. There is no diagnosing that's happening, and all that. So yeah. So we have a strong feeling that we are not being judged here, or being labeled, or being diagnosed. And the other thing is that in a peer support group, we value the experience of the person and the importance of their subjective reality. It's not I believe so and so, and it has to be the same for everyone. So we value the experience of an individual. So it is so important for them to be heard. I'm being listened to, and it is important that the context is understood from their point of view and not with our own judgmental beliefs and all that. And then the last thing is we recognize everyone as unique and believe people are capable of making decisions. So here, as like we already discussed in the previous slide, we believe every individual is unique and they have their own capability, they have their own ability to think and make decisions. And we do not exclude anyone on their mental status or on their ability to think. So we just accept everyone as an equal, and we accept them. They are able to think and make decisions on their own. So this is where the role of mental health professionals in peer support work comes in. So any work, like any therapy or any intervention that we are going to give to an individual who is in need of support, it has to be professionally done. Like it's not that they have a group and they take care of it themselves, and we don't have any role to play in that model. So a mental professional plays a vital role in the recovery of persons' mental illness. While medical experts focus on medical recovery, non-medical stakeholders are responsible for personal recovery and social reintegration. So especially when we talk about psychiatric recovery, from recovering from a psychiatric illness, it's so important. Both medical practice and the non-medical stakeholders work hand in hand for a better recovery and a speedy recovery. So often when I was in NIMHANS, and we often face such issues where when we have helped a patient to recover from the illness and they're able to work and they're ready to go into the community, but the community do not accept them as an equal. Community there are a lot of discrimination, there are a lot of stigma attached towards the illness, and the family is facing, and not just the patient, it's also the family that's facing a lot of stereotypes and discriminations. So it is so important for the non-medical stakeholders like social workers, psychologists, and other stakeholders inside the model. They have to take a step where the patient is recovered and integrated into the community. This is very important. So getting a job is difficult for them. Getting placed in a equally paid job that like other person is difficult for them. So all these things has to be addressed and handled by the non-medical professionals in the model. Then the mental professional facilitates the peer support group as a non-peer participant. So when the group is formed inside the community, it is so important for the for the mental professional to be a part of the group. So when we say, will they be able to share things that they used to share if a medical professional is not there? But that's not true. We have to build a rapport with them, provided they also consider us, the mental professional, as part of the group, and they are able to share what they are going to share among the group. So continuous monitoring is very important. Maintaining case reports and how they're improving, like whenever there is a relapse and how to handle that process, and everything is important too. And that's why, especially in a mental health field, a professional service is always needed inside the community. So, and it also encourages the participants to find what they want. Most of the time, they find difficulty in finding the resource. Where is this coming from? Where do I approach this? Where do I get this? And all that. These kinds of needs are always there in the community, especially in mental health persons dealing with mental disorders. So, a mental professional has to be aware of what is the service that's available for them. How can they meet those needs and all that? So it's not just they recover and then they go out just like a fever or a cold, they just take tablets and then the next day they can go to office. But then that's why there's something called an institutionalized work and the halfway home, and then there's community work, and then they're reintegrated into the community. This process takes time and it requires continuous monitoring from the mental professionals. Then it also helps the community to overcome and break free from stigma, stereotypes, and discriminations. So we may find often that people in the community are not accepting because of their own beliefs and all that. And it's our responsibility to go to the community, talk to them, make them understand what it is really. And just like these days, there's so much awareness that's being built around looking for support for physical ailments. It's also equally important to get support for mental health issues. And it's also important to tell them that the community is responsible for their recovery. So when there is a sense of owning and there's a sense of belonging that they are responsible for the things that's happening around in the community, then it also builds up and helps every individual as part of the community, and they have a sense of owning that process. So that's the model aims at. So where there is no discrimination or stereotyping among the community towards these mental health or mentally ill patients. So having said, we have spoken a lot about peer support model in community setup and all that, and yet in India it's so underutilized. And why is that? So this is the question we all must be able to answer. Like, why is such a good model of mental health, which is very effective in other domains of health, not so used and not so promoted in the community, like in a country like India? So this is the findings in one of the researches by Dr. Patare. The prevalence of mental disorders among the Indian population is 13.7% according to National Epidemiological Survey in 2016. So it also estimated a treatment gap of 73.6% for severe mental illness and 85% for common mental illness. So this is the treatment gap that we have that should be addressed, that needs solution to. So when there is a prevalence of in a country like India, where this population is like 1.2 billion and the prevalence rate of mental disorders is 13.7, and yet there are only few thousands of psychiatrists that are available in the field who are practicing and all that. And the treatment gap for severe mental illness is 73.6%. And this is when it's important to empower the community to take care of these disorders, to fill this treatment gap. And there's also for 85% for common mental illness. That common mental illness includes, as depression, anxiety, hyperactive disorders, everything. So that itself is 85%. So we lack professionals, we lack mental professionals for these for filling these gaps. With very limited resources of mental health professionals in the country, a community-based peer support group for persons with mental illness would be an effective model for recovery. So apparently, the National Mental Policy of 2014 does not mention anything about peer support work. So this was the recent law that came in for mental health policies. So that didn't mention anything about peer support work or peer support volunteer and what are the other models that those models of recovery were not explored in the National Mental Policy for peer support work. So that's one thing. And on the advocacy level, where we have to concentrate more on the policy level changes that should happen for such kind of models to be encouraged and motivated and promoted inside the community. Then last but not the least, it's the challenges faced in peer support work. So there are a lot of challenges that's been faced until date in the peer support work. Apart from the more obvious things, there are some lack of role that's been very specific to a peer support group, which is the lack of role clarity for both peer support providers and other employees in the system. So this means that when most often we face this in the community as well, when we have the group discussion among the in the institution is set up, an individual who has mental disorder often confuses him with the other professionals. We cannot say that the psychiatrist cannot do this. We cannot say a social worker cannot do this. So that there lacks a lot of role clarity. Even most often what happens is a social worker becomes pseudo psychologist and a psychologist becomes a pseudo social worker, and all these role clarity issues they face in the peer support work is there. This is one of the challenges in the model. And the other thing is difficulty to maintain role-related boundaries as it impacts the working relationships. So the professionals will have to have role clarity and maintain that boundary, where to stop and where not to stop, where they can go overboard, where they should not go. And these boundaries are difficult to maintain in a peer support group. The third thing is participants are often concerned about returning to work after recovery due to the fear of stigma and discrimination. Again, this is one of the greatest challenges that we face. Even if the management is ready to appoint them and ready to pay them enough for the work they're going to do, the stigma and the discrimination they're going to face, the fear of stigma and discrimination they're going to face in the premises or in the community is a concern for them. So this also can be overcome by peer support work. And the next thing is peer support worker volunteering is part-time and does not yield the worker and volunteer enough income. Again, like we earlier spoke about the lack of the treatment gap in the mental health setup in India. Similar to that, peer support work is not recognized. Like peer support work or volunteering is not recognized, and they do it for part-time, and we do not have people coming in regularly for the peer support work as a profession or a volunteering work. So that's another challenge they're facing. Third, and one more thing is that self-disclosure is one of the major challenge in peer support work. So when we talk about self-disclosure in the group, most often we forget what is the information that can be revealed and what cannot be revealed to the group. So the peer support workers lack this clarity of self-disclosure, and they keep sharing, and sometimes those sharing can affect an individual who's currently in treatment. So that's one of the challenges that we face. And the last one, lack of adequate professional supervision of peer support work and unrealistic work expectations. And recovering from a mental disorder takes a lot of time, and we cannot have any unrealistic expectation that in 2 days it will get cured, or in 4 days, in a week it will get cured. And it's a process that takes a longer time, and we'll have to accept that and expect what has to be expected from the group. So this is another challenge that we'll face in a peer support group. And this is the last slide of community and peer support groups. So when we integrate community and peer support group, it encourages peer support groups in community and reduces the prevalence of stigma towards mental illness. And it promotes acceptance of recovered individuals in the community, and it motivates mental individuals to recover sooner and better. It gives access to resources and creates opportunities. Community-based peer support groups benefits not only the affected individual or their family, but the community as a whole. It paves way for collective harmony in the community. So when there is no discrimination or stigma, stereotype, any fear or beliefs, myths towards mental health or mental illness, it creates a good collective harmonious community, and it becomes a place for everyone, and everyone can live happily in the community. That's the whole core of having a community-based rehabilitation and community-based peer support groups. So now we are open to discussion and insights from the presentation. If anything, we can discuss now.
Yes, thank you so much, Narendran sir, for that elaborative insights on community-based rehabilitation and the role of peer support groups and what are the challenges that are faced by them. As you said, definitely there is a lot of stigma that is associated with mental health, and people are yet to have that awareness and also break the barriers and break the stigma that is pertained to mental health issues. And also we should have defined roles of peer supporters, that too in our Indian context. Thank you so much for giving such a wonderful topic for us, and the floor is open for question and answers. Participants, you could put the questions in the chat box, or you could unmute yourselves and ask the question.
Yeah, thank you so much, Dr. Veena, for that comment. I hope it will be carried out in the community and encouraged among the students as well.
Hopefully, sir. Thank you so much. Yes. Any questions?
I think I can.
Yes, we are getting the feedback. Like, sir,
Yeah,
can
yeah.
you please stop sharing the screen so that it will be?
Yeah, I'll do that. Yeah.
Before someone asks the question, I want to shoot a question.
Yeah, sure.
I said, because there is a lot of stigma associated with mental health, and moreover, as such, people approaching to take help for their mental health issues will be very, very minimal. And moreover, even if they approach, they will be going either to consult a psychiatrist or a psychologist. So, how do you think these peer supporters would play a crucial part in that?
Yeah. Like I said, a peer support volunteer is not a professional who can be consulted for an illness or a disorder to overcome a challenge. So it has to be a guided approach. It has to be guided by the professional mental professionals who are trained and has the knowledge of dealing with such things. But what happens is, like, when we have a peer support volunteer or a worker inside the community, the whole concept is about having a peer support worker in the community, where it creates a platform for someone to talk about mental health, to talk about mental illness, talk about depression. Like, most times we lack someone who can listen to us from our point of view. So that can be addressed by having a peer support worker in the community. And even the peer support worker has to be trained, and if there is something that has to brought to the notice of a professional, it has to be brought to them. So that's how this model is designed to work. Dr. Veena, please unmute your mic and yeah.
Right. Thank you so much, sir, for that answer. Thank you so much. And any other questions from the participants? So, what are the few challenges that you have faced with these models? Is there any challenges, or is there any incident particularly you want to share while implementing this model?
Yeah, of course I can. I was doing a project in NIMANS. While I was there, I was working in the rehabilitation, psychiatric rehabilitation services department, and most of the individuals who have been recovered and are ready to work in the community, are ready to be integrated in the community, were still coming to rehabilitation services. Reason being, they were not able to grab an opportunity outside the service that's provided for them. For example, I know an individual who was very efficient with his computer and all that, and he was even very good at data entry and all that, but he wasn't able to procure a job, uh, secure a job for himself outside when he walks outside the service that's provided to him. So we had to go talk to the concerned management. Even though the management is ready to accept them, they even feared that the other co-workers will not be able to accept them. So it's not just one individual who's taking these decisions. So we had to train the entire team on how to work with these recovered patients. So in time, they also have this inhibitions that if I do this, and will I be able to will I be accepted in the group? So that's another thing that we also face in the community, also in the reintegration part. So peer support work especially helps in reintegration into the community, in the office space, in the workspace, and all that. So that's one of the incident that we faced, and the company was actually ready to appoint them, and we even got job for some of the recovered patients. So I would share one more thing on this work. So in psychiatric rehabilitation, there's two things. One is vocational training, and other thing is like academic training that we've already had. We faced less difficulty in putting them into a skill-based work than into a professional setup. Like, for example, this individual I'm talking about, he completed his MS from the US and was finding difficult to get a job in a good company. But when we also trained someone who was not even completed 12th standard on a skill-based work like vocational training, and he got placed immediately. He was earning like 15,000 per month. Like that was actually pretty. The acceptance level at that stage is pretty simple for us. Was easy for us. So I would say like skill-based work is preferred in the community. So that's another incident that happened when I was in rehabilitation services.
And what do you think would be the limitations for peer support works?
The limitation would be there is no standard income, or there is no standard set of rules for them. Like, for example, if there's a social worker or a psychologist, we know what is our role in the community. That role clarity is not there, one thing. And then they're not paid enough. And to encourage for someone to take it up as a career. So without a professional, without someone taking it as a career, or they should have this conviction towards the work. Only then they'll be able to do the work efficiently and be able to think from the other person's perspective. So that's the major challenge that we face. And I think there's a question. Peer educators were mostly in village. Why not mostly in cities? Yeah. So yeah, when you talk about cities, most of the things have been changing, and we are moving into a more nuclear society. Even though there are hundreds of people around us, the population increasing, but we're still becoming a nuclear society. And this is not a new model. Like we used to have our relative uncle coming to us and talking to us about our difficulties that in life, and we do not have such kind of personalities in our life anymore. Now we think who to talk, and we also have these inhibitions in life, that are we allowed to share all these things to someone? So that's when we started like it's okay. It's okay to feel depression. It's okay to feel anxious. It's okay. It's a normal thing, and we're encouraging that thoughts into the individual's mind. So that's helping now, I would say. And the rural setup is a collective setup where everybody knows everyone, and it's easy for them to communicate. While in cities, it's really difficult for someone to communicate properly to another individual. Fear of being judged, fear of being discriminated, fear of being bullied. So all that is there. I would say even in the rural setup, those things exist. Still, somebody is coping up with that, and they'll increase that in cities as well.
Thank you, Narendran sir, for answering that question. And yes, we have got a feedback from Swarabhushan. Like, it was wonderful presentation. Thank you, Mr. Narendran, for taking your time and addressing the another dimension of being a social worker. So thank you, sir. Thank you for your
Thank you.
feedback. Definitely, yes, it was really very wonderful session we had today. And like I said, there should be a lot of such innovative programs and innovative projects that have to be embedded with other facilities that are provided in mental health care. And soon things will change for better, and hope so. Thanks again, and I would request Shubha ma'am to please place vote of thanks for today's speaker. Yes, Shubha ma'am.
Thank you, Veena, for inviting me.
Yes, my pleasure.
Am I audible?
Yes, ma'am. Yeah, ma'am.
Thank you so much for the wonderful session. You have really clearly given the nuances of the community based and also the peer support, and we really enjoyed the entire session. Thank you so much for sharing your expertise with us, and we place a record of thanks from Department of Psychology, American College, Madurai, and as well as MS Challamuthu Rehabilitation Trust, Madurai, and the other collaborators like Madras School of Social Work, Chennai, and the other collaborators. I really sincerely thank you for your presence and wonderful presentation today. Thank you so much.
Thank you so much, Shubha ma'am, for having me today. And I thank all the participants who have been wonderful audience today. And I hope to have more sessions and attend more sessions of American College of Madurai. So thank you so much for having me today. And if there is anything, please do drop in the text box if something else.
Yes,
And I hope
Narendran sir, you could type your email ID so that if the participants have any queries, they could get in touch with you to know more about this peer support group.
yes, I'll do that right away. Yeah, so that's my email. Anything in future, you're welcome to mail me. I'd be happy to answer your queries.
Yes. Thank you so much. And participants, you have the email ID of today's speaker in the chat box. Kindly note. And if you have any queries, you can write to him or kindly send your feedback and queries to myWebinarFeedback@gmail.com. We will meet tomorrow with yet another wonderful session. Thank you. Good night. Bye-bye. Thank you, Narendran sir, for the
Thank you.
session.